Hi, I'm Dr. Mui from Mui Chiropractic and Sports Medicine. I'm going to tell you guys about FAKTR. So what we're going to do is we're going to use Kevin as our model. Kevin had a bicep strain, so we actually applied a lot of the Graston principles on him already. So what we did is we already took the tissue in a static form, we actually worked it. Now what happens with normal tissue is that the tissue itself normally should glide like this. With tissue injury, the tissue heals in this type of manner. Alright? So with Graston technique, we actually took the tissue, like the tissue in my hand, which is all convoluted, and we actually broke through a lot of those adhesions. Now what happens is that there is still a little bit of residual in the actual bicep itself. So we need to get it to the next level. So that's why we start incorporating the FAKTR protocols. Okay? So what happens is we need to load the tissue itself. So let's say Kevin does a bicep curl right now, and he gets to a certain point, he's like, ow, that hurts. So we know that the restriction is actually within that range of motion. So what we're going to do is we're actually going to have him do a bicep curl, and as he eccentrically loads the tissue, we're actually going to work it with the Graston tool. So you come back up, and then slowly go down again. And as we do this, we're taking the fibers, which are kind of like this, and as we eccentrically load the tissue, it's actually pulling the fibers this way, and as it does that, we're actually loading it, and we're actually making the tissues realign this way. So this will actually take him from that plateau where he was at, and actually take him to that next level, so he'll be pain-free when he goes to the gym.